Are you ready for the monster that's coming to hit you? I'm just kidding. I'm just kidding. Term 4 recap. Are you ready? Stay tuned to find out. Well, hello there and welcome back. My name is Nanette and this is my journey into becoming Dr. Nanette Varela, and this is the moment you've been waiting for, Term 4 recap. This video might be a little long. I will talk and tell you everything you need to know for this term, but oh my god, I hope you stay till the end because there is a lot to talk about, a lot that you need to know, okay? So I am here to share all my knowledge and my experience with Term 4, and I really want you to do your best, and I am here for you whenever you need it. So are you ready? Let's get started. Term 4, the monster that everyone is talking about. You have just got into your second year of medical school and you are ready to rumble your next year for basic sciences. And this one is not easy. It's coming high. Difficulty level is getting even higher. So now you have left behind your first year of medical school and you have finished with your physiology and all the theoretical of all the theories that you need to know. Starting your second year of medical school, we are breaking it down to pathologies, microbiome. So basically, this is the basis of everything you really need to know. So Term 4 is going to start off with 4 modules. Module 1, FTCM, Foundations of Clinical Medicine. Number 2, CRS, Cardio-Renal System. Module number 3, RHS, Renal and Hematology System. And number 4, DERS, Digestive, Endocrine, and Reproductive System. So now you will be going through all of it all over again, but now it's going to be your pathologies and your microbiomes and infections and everything that has to do in clinical medicine that you will be seeing. So let's start off with the other part that you will be having, which is your OSCE. Again, like every exam term, you will be having your clinical encounters, and these are going to be a little bit more different because now you're practicing to become more knowledgeable in the experience of clinical medicine, and you're going to be, exposing yourself to really have a great clinical patient interaction. We'll talk with that at the end. But again, you will be having 4 module exams for each module, and then you'll be having your OSCE exam, and again you'll have a couple quizzes here and there. You'll have your professionalism points, and you will have your OSCE exam at the end. Before we get started into going into the nitty-gritty, a little bit of each module, this is my honest opinion on Term 4. Term 4, everyone scares all the lower terms and tells them Term 4 is so hard, so hard. Everyone fails. Term 4 is really a term where it's gonna take away the outliers from those that, have been pushing through really hard at the end. And my recommendation as study strategy goes, and the idea of Term 4 is hard. Term 4, it is super hard, but the reason why I believe Term 4 is hard, and again, this is my opinion, but it's something that I've really, noticed with all my peers and everyone that usually really does come to me and talk to me, is the issue with Term 4 is that we do not have time to study. Our time to study has cut down a lot. What do I mean by that? It means that you will be having lectures, you will be having so many small groups. Back then you only had around 2 to 3, maybe max 3 small groups in a week, but for Term 4 you will probably have small groups every day of the week, 5 times a week, 4 times a week. You will have your, what we call them, Belford small groups, which are your traditional small groups, and these are going to be your content material small groups. You're gonna have again your small group, and you're gonna be presenting for each small group. These are your Belford small groups, is what we call them, and they are gonna be basically student-led small group interactions. So your facilitator is just going to be there just for them to recap the material, answer any questions that anyone does have. So you will put your group together. You guys will come together and agree on, you know, what slides and topics you will do. So, you know, you will focus on just the topic that you have, and you will present that. Most of the time they do not allow you to have your iPads when you're presenting, so this is just you going up there and, you know, presenting the material to your students basically. And it's really helpful because, again, it's like, you know, you're gonna prepare for it, of course, but you will be hearing your other peers and how they explain a topic, and that's gonna be really helpful. They're gonna show you a video. It's gonna be mostly like a DLA. They're gonna show you how to really, you know, break down that type of small group, because it's very different to what you've done before. This time it's just you presenting the topic, mostly similar to like your histology, where you have to go up to the board and, you know, present the histology image. It's kind of like that. You will also have to present the histo and explain what you're seeing, but then you're going to have to go in depth. You know, what's the etiology, the pathogenesis, how are the complications, what are the signs, what are the symptoms, what are, you know, your treatments, how do you, you know, do your investigations, all of that. It's going to be a little bit more in depth, but it's a really good time for you to really sit and take that time to really help you emphasize in the material. Because again, you have so many small groups during the week that you might not have the time to really study. So the time that you do get to review your material, you really have to sit down, focus, so you can absorb that material. Then you have your B-line small groups, which are your clinical experience small groups. Sometimes they get intercalated during the week, so you will have maybe 2 B-line with 3 Belfords. You can have 3 B-lines with 2 Belfords. It just really depends how they set your schedule up. But your clinical experience ones is going to be the time for you to really throw yourself out there, practice all your physical exams, because there will be having exams on you. You will be having patient interactions. You're going to start learning how to really talk to a patient, how to do a patient history, how to, you know, get to a conclusion on what's going on to the patient. So you will be, you know, brought in little by little. It's not like they throw you in there, you know, and be like, take a patient history if you've never done one before. So you're really going to have a couple lectures on how to really do a patient interaction, how to do a soap note, how to really, you know, do that patient interaction portion, not just learning your material and knowing what's going on behind the pathogenesis, but really how to speak with the patient, how to show empathy, how to really get into the patient history, and how to, you know, ask the questions for the patient to tell you what's going on with them. So that honestly was my favorite part of term 4, those B lines, because they are amazing. And you really do get to practice. You get to put on a patient. You really get to practice your time on a standardized patient, and that's really going to help you out. You're going to have kind of like 2 exams for your clinical encounters. You're gonna have one physical exam before your like real OSPE. You're gonna have a physical exam where you're only gonna basically do kind of like the OSPEs that you've really done before, where you just walk in and just do the physical exam and just show your the way that you do the physical exam, make sure that you know how to do it. That's basically that exam. And then the following week, you're going to have your real OSPE, where it's going to be a full encounter. You're going to have 17 minutes to do your patient interaction. So you're going to walk into the room, you're going to do a full patient history, and then you will have 10 minutes to write your soap note. In those 17 minutes, you will be doing your patient history taking and your physical exam. So you have to do all of that within those 17 minutes. Once you're done, you will be doing your soap note, where you're going to write everything that you encountered during that patient interaction and your differentials and your plan. And you have 10 minutes to do that. Okay, it is more than enough time. I finished in that time frame. It's just practice. And my recommendation is take an important role there. You're gonna do roles during your beeline within your group. In your beeline group, you have a team leader, you have a patient interaction, a history taking person, you have an evaluator for history, you have a physical exam student, you have a physical exam evaluator, you have a critical thinking, you have a communication skills evaluator. And my recommendation, sometimes it might not be every day that you want to perform and do something in front, it's the reality, so you could take an evaluator position. But my recommendation, really go in there and take the physical exam position, take your history taking position, take your critical thinking position, because you need to really, the day of your OSPE, you're gonna have to stand up there and do everything within boom, 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 and you don't have time to really sit there and think and be like, what's going on, if this is with the patient, this symptom, this investigation or plan, and there's no time for that. So you really need to have already done that practice. You can't wait for your exam to do that. So that's what your beeline is there for you to throw yourself out there, practice, make sure you know how to use your stethoscope, all your PD kit, all your all the things that encompasses a clinical encounter. That's the time for you to practice. So that's going to be that main part for term 4, your small groups. So make sure to, always be prepared. Even for your beelines, be prepared. Read the PDFs that they give you, because they're going to tell you what's the main patient complaint. So, chest pain, diarrhea, constipation, if they have, shortness of breath, make sure you have read the PDF and gone over some differentials, because before you even start, you will have a main discussion with your team. So it's very important for you to really put yourself out there for small groups. Be prepared, take that time for yourself. Now, again, one of the main things everyone says, again, is no time, no time, no time. It is so hard. My main thing is, do not change your study strategies. Term 4 is not the time for you to start playing with Anki. If you never touched Anki, it's time for you to do some whiteboarding. If you've never done whiteboarding, stop right there. If you have gotten to this point with the study strategies that you've been doing, this is your time to really use those study strategies and just put the metal to the pedal. Because honestly, there is no time for you to start playing around with what study strategy should I use, what am I going to play with. And if you start playing around, materials coming at you really fast, and it is a lot. Back then you had a couple diseases, now it's full lectures of diseases back to back. You have viruses, you have infections, you have respiratory infections, you have skin infections, you have all of it coming at you, and there's no time for you to really be like, let me start to play with Anki if I've never done it before. Don't do that. Stick with your study strategies. Stick with them. If you want to reinforce them, I say reinforce maybe with 1 or 2. What I did was I did the same thing that I've always done, taken my notes, done my Anki, do my practice questions, but then I added sketchy. And then I really reinforced some sketchy videos, do some practice questions from the sketchy website, do, mnemonics that they really help you out, watch those videos. And that's really going to help you out. But it's not to sit here and start playing with new things, because honestly, this term, it's going at 100, and there's no time for you to sit back and start trying new things. So my recommendation is, take breaks. If you have lectures, you have small groups. By the time you get out of small group, it's going to be 3 o'clock, probably 5 o'clock in the afternoon. You have IMCQs really late at night. So the little times that you have in between, you really need to take advantage of that time to study, and to study efficiently, because you can't be, playing around. You can't be like, I'm tired. Yes, we are tired. You will be drained. By the time you get to that last module, doing term 3 and term 4 back to back, you're really gonna have to push it through, and I'm telling you, it's going to be burnout 100%, 1000%. You're gonna feel that burnout. And honestly, if you're not doing as amazing as you would like to, start looking for help early on, because by the time you get to exam 3, there's no really other exam other than your last module exam and your OSPE. And if you haven't gotten to where you got to that passing level, really recommend for you to look for help, reach out, get advice, academic advice that will help you out. So let's go into a little bit of the modules. Again, it's typical 4 modules. Module 1, FTCM, Foundations of Clinical Medicine. It's going to be 5 weeks of material. That's going to be your first exam. It's going to be basically the foundations. You're going to start seeing some of that lectures on clinical medicine, your clinical encounters. You're going to have some skin infections, and things are going to be broken down again category. Immunology, microbiome, pathology. They're going to be your main categories of your exams. Again, find that study strategy, break it down, take advantage of your small groups. They're going to be really helpful. In that first module, you're gonna see some things. Remember from FTM that you had some pharmacokinetics and some drugs? Well, you're welcome to pharmacology. You will be adding some pharmacology, immunology, microbiome. Microbiome and immuno are going to be mixed in a little bit. You won't see any more of immuno later on, other when you get to like hematology, but you will be seeing pathology, pharmacology, and microbiome. So those are going to be your main categories for term 4. So starting in FTCM, you're going to see again like the first main lectures that you saw in FTM back then of pharmacokinetics and pharmacodynamics and your autonomic drugs. You're really going to see that again. They're going to be DLAs. They're not going to be lectures, trust me. So that's going to come back. You're going to start getting into the basis of pharmacokinetics, pharmacodynamics, your new drugs. Make sure you know everything about those drugs, adverse effects, and the signs and the symptoms that those drugs cause, the mechanism behind it, and the drug name, the category of the drug, what it's used for, any type of regimen. You guys need to really know those things because they could ask you anything under that. Anything. So again, pharmacology, make sure that you know the little details, especially adverse effects. Patients are going to come in with certain type of signs or symptoms, and they're going to be like, what drug was given? How do you treat it? If it has a treatment, what other side effects can be seen? It's not going to be any more your simple first order questions. Your questions are going to be more in depth. Remember, now you're going to start bringing in all the concepts that you know from first year, bring it into your second year, and then you're going to incorporate it. Those questions are going to be tricky. You really need to read them, focus when you're reading them, and really bring it in, and just make sure you understand what they're asking you before blurring out an answer. And then you have your pathology. You're going to start seeing a little bit about, how is a healing process, what is, necrosis, apoptosis, that type of processing. You're really going to see again the process of reactive oxygen species, how to attack the body. So that's going to get a little bit of some material you've seen before. Some is going to be really new. The coagulation cascade, all that stuff. You're going to see a little bit because it's your foundations. Is the foundation of clinical medicine. So if you're really, cover everything and do good on that module, it's going to really help you out in the following ones. Module 2, CRS, cardio and the renal system. The cardio and renal system work together. So this module is going to be a 4-week module. You're going to have around week 1 and week 2 is going to be cardio, 3 and 4 is going to be renal. Again, you're going to have, for cardio, you're going to have pathology, pharmacology, and microbiome. So all the infections that can cause cardiac disease. You're going to have all your pathologies of cardiac disease, atherosclerosis, hypertension, myocardial infarctions, all the blood vessels, disorders, anything that has to do with the cardiovascular system. You're going to review it within those first 2 weeks. You're going to also have your drugs. You're going to have your antiarrhythmic drugs. You're going to have your anti-hyperlipidemias. You're going to have your statins. You're going to review all of that. You're going to learn it for your first time. So that's basically what is going to be the cardio section. Then you have the renal section. Again, you're going to break it down into your nephrotic and nephritic syndromes, and you're going to need to know all the little details. Remember, histology images, what is the mechanism behind that pathology. You will be seeing microbiome, so all your UTI infections, all the infections that are going to be seen throughout the renal and the cardiac system. So this is like the first time you'll start seeing more of the microbiome. You saw some skin infections in FTCM. Again, microbiome, you need to know everything about that bacteria, the virus, the fungi, the parasite. What is its category? How does it produce clinically, like on an agar? How do you do the investigations? How do they present? How is the bacteria? Is it gram positive? Is it gram negative? Is it catalase positive, catalase negative? You need to know all those little details, all the characteristics of each bacteria, viruses, fungi, anything that has to do within those infections and what causes it. That's basically the mechanism behind it. And that's going to be seen again in the cardio and the renal system. It's going to be your main categories for each. Module 3, RHS, your respiratory and hematology system. So this is going to be a 4-week module as well. The first 2 is going to be your respiratory system. Again, you're going to do your pathologies, your infections, your respiratory infections, and your pharmacology. So it's going to be your pathologies, everything that has to do with your obstructive and restrictive disorders. You're going to really go into in-depth of everything that has to do with each pathology. Again, mechanism, etiology, where is it most seen in men and women, the age frame, you know, all those things are gonna get thrown at you, and you really need to know all those details. It is a lot, but again, you will start catching on to what's the important things. Then you have your respiratory infections. This is a big chunk, especially for the respiratory system. Your pneumonias, your tuberculosis, everything that causes it. Again, remember, what is the causing agent? What are the features of that causing agent? What are the microbiome techniques that are going to get used? The second 2 weeks are then going to be your hematology. So your red blood cells, your white blood cells, and your lymphatic disorders. These are mainly going to be mostly your cancers, your non-Hodgkin lymphomas and your lymphomas. You're going to see all red blood cell disorders. Again, you're going to see sickle cell, thalassemias, all your hematopoietic stem cells and things like that. It's going to be seen your white blood cell disorders. All of that's going to be seen. And again, you're going to see your pathologies, your microbiome, and your pharmacology. Again, it's just those main 3 categories for every module. So if you break it down like that and your reviews are like that, I'll review pharma, I'll review pathology, I'll review microbiome, that's really going to help you out. Last but not least, module 4, DERS. By the time you get to this module, you will be mentally and physically drained, my dear. You're going to be out the door, but this is the time for you to really push through. We're talking about almost a 6-week module. It is long, it is heavy, it is, oh my god. You have digestive system, you have the endocrine system, and you have the reproductive system. So digestive system, again, pathology, microbiome, and your pharmacology. That's going to be for pathology, everything that has to do with any disorders from your stomach, like inflammatory bowel disease, Crohn's disease, ulcerative colitis. Then you have your diarrheas, your constipation. What causes diarrhea? All your microbiomes, all the bacteria. You need to know all those bacterial features, everything that has to go in it. Then you have the pharmacology, how to treat your inflammatory diseases, anti-diarrhea drugs. You have your laxatives. You have all of that categories are going to be in there. Again, knowing mechanism, adverse effects, the signs and symptoms of the drugs that can cause the symptoms and things like that. And then you have your endocrine system. This is going to be, for me, I really liked this endocrine section because, again, it's like your ER module where you're going to start seeing, again, you know, your pituitary adenomas. You're going to start seeing all the symptoms of that. You're going to start seeing your hyperthyroidism, your hypothyroidism. You're going to see all the endocrine disorders that have to do. You're going to see, again, your adrenal hyperplasias and things like that. And that's going to be like a main review. So if you really did really good back then in ER, it it really helps for your endocrine, and the professor that teaches it is really, really, really good. Then you have your reproductive, and here you're gonna do male reproductive and female reproductive, but again the big chunk is gonna be female reproductive. So you're gonna go over all your ovary pathology, uterine pathologies, you're gonna do your breast pathologies, you're gonna do all your infections, you're gonna do sexually transmitted infections, you're gonna do all the infections that can be found in the uterus other than, you know, sexually transmitted infections. You're gonna do pharmacology again, anti-cancer drugs, especially for the breast cancer, you know, hormonal therapy, contraceptives, all of that you're gonna review for term 4 in that last DRS module. So that module at the end is really gonna like pack a punch because it is such a big module and is the last module. You're also preparing for your OSPE exam, which is at the end of the module. Again, you'll have your DRS exam and then you have your OSPE exam. But again, it is basically your main 3 categories for this whole term: pharmacology, microbiome, and pathology. Make sure, however you want to break it down, you break it down for each. Make sure you focus on each concept of the diseases, know the idea, the mechanism, the etiology, where does it come from, how do you treat it, and then that comes in with the pharmacology section. Well, how do you treat it? You know, if you have an arrhythmia, what type of arrhythmia? What is the drug that you give for that arrhythmia? And things like that. So the pharmacology is going to hit you a little bit at the beginning, but again, you know, slow and steady will be your A game. Do not change your study strategies. If you want to reinforce it, reinforce it. If you want to, you know, ump it up a little bit, do so. But my recommendation, do not start playing with new study strategies. This is not the time to do so. You know, it's time for you to really, you know, focus on what really works for you. Don't worry about what everyone else is doing. Do not compare yourself to everyone else. Just do what works for you. Go for it 1000%. Do your best. Push through. It is a hard term. It is a hard term. And honestly, it's just hard because there is so much happening at the same time. You have small groups, you have Beeline, you have your Belfort small groups, you have your lectures, you have IMCQs, and your day is gonna go by so fast, and then you're gonna sit there and be like, when do I study? I have lectures for 2 hours, you know, so you really have to wake up early, take that time, you know, after lecture, take that time, because by the time you do your small groups, it's gonna be, depending on your college, you have it at 1 o'clock, you'll have it at 3 o'clock, and by the time it ends, you're probably gonna be there the whole entire time, depending on how your group works, depending on how the facilitator wants you to really present, and things like that. But at the end of this road, whatever happens, this is your time to really focus. You know, it's not the time for you to start playing around. Honestly, this is a hard term and you really need to focus and push through. Do your best. Do your best. Do not compare to anyone. Do you know, there's time where you're really gonna doubt yourself. You're really gonna be like, do I even know enough? You're never gonna know enough. That is the reality, but you really do have to focus on what you're doing. Trust yourself. Trust yourself so much that you will push through at the end. And trust me, you will, because it happened to me. This is me speaking from the bottom of my heart. There are times where you're gonna sit on that test to start and you have no clue if you even are gonna know the answer to that first question, but you cannot panic. You know, take deep breaths, trust yourself. You are studying every day, you're putting that hard work, so you really need to, you know, trust yourself. At the end of the day, just trust yourself and do your best. So again, I hope that this video helps you. It was a little long, there was a lot to talk about. If you have any other questions, feel free to DM me. Don't forget to subscribe to my channel, like this video, and let me know down below if this video was helpful or any other content that you guys would like to share. Next term is term 5, last one of basic sciences, and I am all here for it. So I will be showing you guys a little bit more about what it is to be term 5. This term 4 was crazy, had no time to share with you guys, but I really want to show you guys that last term for term 5 on the island as a basic sciences before starting to study for STEP. So I hope you guys enjoy this video. Don't forget to subscribe to my channel, and I'll see you guys next time. Bye.